Okay, so today we're going to talk about what's new in version 29. And I don't have the final version yet to share. It's still under beta, so I'm not going to be showing the actual product itself today. We're going to talk about it. You're going to be asking questions. Now, if you want to ask questions, because we have a lot of people on the seminar today, if you can please type it, and Kim is going to help me reading the questions. So what's new in version 29 is integration with, so now MEDISOFT, they created their own product to integrate with MEDISOFT. And that product is you can process credit card and ACH, and I'm going to show you like a quick presentation that's recorded. Then there's something called out-of-pocket estimator. We know the No Surprise Act is something new regulation that we have to comply with, and the No Surprise Act, it mandates you to be able to tell the patient how much their out-of-pocket is going to be. And now the new version 29 will be able to print an estimate to tell the patient what the procedure out of pocket is going to be. So you will be able to print like an estimated statement for the patient to have. And now the patient can also pay that pre-estimate either by credit card or ACH. Then we have an improved multi-link. When you have a procedure that has more than one CPT code, now we've been having that for many years, but what is new now, you can link the diagnosis because some procedures or CPT code might not be related to one or two diagnoses. So you can have all this diagnosis code up to 12. Then you can have the CPT code. Then you can say this CPT code is going to have which diagnosis. So you will be able to turn on the check boxes on each diagnosis. So that multi-link is something new that we didn't have before. So you were only able to put the CPT code, but you could not have the diagnosis linked to the CPT code. So now we do have that. Then we have new and improved tools for patient engagement. So I'm going to show you something that we created ourselves, and I hope everybody is going to like it. So again, if you like to ask questions anytime, type your questions, and Kim is going to help me reading the question. So, happy to answer those. So now I'm going to run this presentation here that's created by the MEDISOFT. So I'm going to run it.
CGM MEDISOFT is the gold standard for hardworking practices. Engage patients, increase collections, and streamline operations with MEDISOFT version 29. Now with MEDISOFT version 29, the practice management solution you know and love is even better. New to MEDISOFT version 29, practices can enjoy a fully integrated credit card and ACH payment processing option. Set up and automate monthly patient payments more easily with CGM Pay. It's all at your fingertips thanks to the new MEDISOFT dashboard view. Update payment methods, print and reprint receipts, save multiple payment types, including a patient's preferred payment method, manage refunds and voids, and
so this is important here is so I can have multiple payment options. So I can have a few credit card and I can have an ACH. Now, what's so important here, it's compliance. What does that mean? It's actually illegal for you to keep the credit card information on file and somebody can read it. What does that mean is I've been to practices where they're actually having the credit card in a spreadsheet or in a book and anybody can read it and process. You cannot do that. That's not compliance. So now if you use this integrated product, you can save multiple type of payment. Then the person on your end is not going to be able to read the actual full number. You will only see the last 4 digit, which is it keeps you compliant. Then you can process it based on, you can ask the patient, would you like me to process on Visa ending with 1156? And if they say yes, you can process it. So you can have an ACH, you can have a Visa, you can have a MasterCard, you can have an American Express, depending on what you take in your practice. So that keeps you compliant. It gives you multiple options. And this way is more convenient for you and for the patient. And of course, by accepting ACH is a wonderful thing because an ACH transaction might be it might be 25 cents or so, but we all know the credit card transaction can be very expensive and nobody carries a checkbook with them anymore. And I hate going to a doctor that they don't take a credit card and I don't carry a check. And then I have to deal with making the payment, and they don't accept like online payment or anything like that. So hopefully this makes it easier for you to accept payment, multiple type of payment without having to cost you the percentage. We all know that one of the main reason that practice don't want to take credit card because it's hard enough to make money in the industry anymore because insurance companies are reducing, passing a lot of this payment, the skin in the game to the patient. And now if you're going to have to pay 2, 3, 4% to the credit card, that just shaves money out of the profit of the practice. So feature like that is a great feature.
Integrate with the popular patient statements offered through our own trusted eMedics clearinghouse. The new patient responsibility estimate lets users provide a good faith cost estimate for planned procedures after quickly running a patient's insurance eligibility for the planned procedure codes. In MEDISOFT version 29, this service expands for self-pay and uninsured patients. Save time with pre-configured multilink transactions for common procedure bundles and make adjustments for coverage, co-pays, coinsurance, remaining deductibles, and more. Providers can print and save patient estimates and have the option to tailor them with customizable messaging and a web link for prepayments or deposits. Transaction entry alerts are more powerful in MEDISOFT version 29. A new date-based warning message alerts users if they enter dates of service outside of specified parameters, saving time and reducing errors. This enhancement is very helpful at the beginning and end of each year as practices transition to new CPT and ICD-10 codes. Want to make a change? Copy existing messaging rules to easily assist in creating a new alert. We've added diagnosis codes to multilink transactions in the MEDISOFT version 29. This enhancement makes it even easier to create charge sets and quickly generate claims that include diagnosis. This improvement eliminates manual entry and the claim rejections that stem from common diagnosis code typos. So much is new in MEDISOFT version 29. To learn more about the MEDISOFT Gold Standard, contact us at 201-322-4100. Don't compromise. Go Microwize.
All right, so let's open the floor for question now. If you can please type your question, and Kim is going to help us. I'm just going to go through, typical questions that I would get. So if you are on the cloud using, the MEDISOFT Cloud by Microwize, we're going to give you the new version as soon as it's stable. So what does that mean? From the final release, which is the final release is probably going to happen, I think it's somewhere in December. After we normally wait 30 days before we release it to our clients, because sometimes you don't catch bugs in beta, and I don't want to mess up somebody where I give you the new release and it breaks so many things. So we all probably been there before, and we refuse to do that. We wait 30 days after public release. Now, if you're new and you're starting a new practice, I normally don't hesitate to give the new version so that somebody new, they might get it right away because there's no data to mess up. And those are usually the easiest databases that we can test it with. Okay, so cloud will get it somewhere in January. So it will happen quickly. Unless you don't want it right away for whatever reason, then you need to let us know, and Kim and Omar will be the ones that handles that with you. Okay, so Kim, look like we have some questions.
Yep, we did have one come up. It says, can you explain something about ERA posting in version 29? Was there something specific that you had a question about ERA posting? There shouldn't be too much change.
So you can unmute yourself if you connected with the audio, and we would love to answer that question for you.
Hi, this is.
I'm sorry, I don't want to pronounce your name incorrectly.
Yeah, this is Mr. Kulkarni.
Oh, hi.
You're able to hear me now?
Yes.
Right now, we are using version 24 of MEDISOFT as of now.
So 24. So there's nothing changed in posting. So the ERA comes from the clearinghouse that we call that the 835 or the electronic remittance or ERA. So whatever name you want to give it. So that file, when it comes in, it gets posted to the patients. Sometimes there's a few glitches where it might not line up with the patient. So we during support, we help you to avoid those mismatching. And if that's what's happening to you now, but nothing really changed to the ERA between 24 and 29. It's been like that for many years. If you are a billing company and you get in a bulk ERA for multiple practices, then that becomes tricky. I worked with development to break the ERA into multiple files, but that's probably not the case in most of you. So if you can tell us exactly what you mean by your question, we'll love to answer.
Right now, we are doing manual posting. We don't have any ERA tool. So
Okay.
under 29, we have any option directly ERA tool that we can upload 837 or 835 file that will automatically arrange for posting.
Okay. Yes, 835 is a wonderful thing to have. Let me share with you a story. A few years ago, a doctor called me and says, Robert, can I ask you a question? I said, yes. He said, why don't you force people to go with ERA? It's a crime, people posting manually. I didn't know how much time I can save by posting the electronic remittance, and it should be illegal for providing the system any other way. And my response is, as much as I love ERA, I cannot be forcing people to have to use it. Okay, once you use it and you see how much time is going to save you, you're not going to believe why did you ever post it manually before. So if you're not using ERA, you should be considering, but your clearinghouse has to provide you the file, and posting it into MEDISOFT is a piece of cake. There's few glitches that comes from time to time, but during support, we will help you to avoid those glitches and how to work around them. Okay, any other questions?
Yep, we have another one. It says, how can we get the pricing for the network edition?
Okay, I think we have somebody from sales. Is it Joe?
Yes.
Okay, so Joe's gonna reach out to you after this. There is a sale going on. It's called a pre-release sale. So Joe, you want to tell us about the pre-release sale?
Definitely, of course. So for our pre-sale, we have two different promotions that are currently going on. First of all, for our cloud, if you're looking to upgrade or to sign up for Medisoft or Lighttech Cloud, you guys will be able to benefit from 3 months for free. So this means that for the first 3 months, you guys will not be paying any kind of monthly subscriptions. You'll be completely enjoying the experience for free. And after that, you will start paying your monthly subscription, which will be based on the number of users that you guys will be utilizing. For our server-based or the local-based version of the software, you guys will be having several discounts depending on the version that you guys are moving up from. The older the version, the higher the discount that you guys will be getting. Our discount has several levels, so we will be starting from 30% all the way till 75%. It just depends on the version that you guys will be coming from, or whether if it's a first-time purchase for Medisoft, the discount will be decided. But all that we can tell you right now is that currently we are in the first round, which offers 30%. And if you're looking to get a clearinghouse service as well, you'll be getting further discount. For more details and for you guys to get something that is more detail oriented, we would definitely love you guys if you can drop your emails, and we would do our due diligence and reach out to you guys to provide you the necessary information.
Thank you, Joe.
My pleasure.
Kim, is there any more questions?
No, that was Joe responding in the chat.
All right, so let me just move on with the next part of the presentation. This is something that I created myself as a company. I created another company to help physicians find new patients and to help physicians be able to book appointment much easier. If somebody wakes up in the middle of the night that wants to bring their child the next day, or somebody's not feeling well and not sure if they should take the day off the next day. So they can go to your website, or they can, if you're not on a platform, they can go and find a provider. So let me just show you what it looks like in real life. So it's up and running. It's been up and running for a few years. So it's called Vozita. So it's vozita.com, and it has a mobile app or the website. So a patient can come here and search for, maybe they're searching for internal medicine. Let's say they're looking for internist, or they could be searching for the provider name, or they could be searching for practice name. And by entering a location, maybe they're, where they live, and or what plan they have. So that they can either look for a video visit, which is sometimes called telemedicine, or an in-office visit. So I'm going to search for the available appointment within that location, and it will find all the providers in that area that have availability. And as a patient, I can, let's say I want to go on Thursday, the 17th at 12 p.m. So if I click on that, now this is a real provider, so I'm not gonna really log in and do that. This is my real patient account, and this is a real provider, so I'm not gonna really book that appointment. So this will integrate with MEDISOFT. So that patient, if that patient does not exist in MEDISOFT yet, it will actually get created in MEDISOFT for you. And if that patient exists in MEDISOFT, it will also mark MEDISOFT as an appointment. And if it gets canceled, it will get removed. Then, of course, we can have a routine. If you do things like, no-show charge or anything like that, we can take care of that part on the MEDISOFT side. And when the patient is done, very important, the patient is going to be able to review the provider. It's a verified visit. So it's not like Google review where anybody can go and review you, even if the patient never showed up into your office. This is a verified appointment, verified patient that is based on a verified patient. There's another way of searching by using the icon, and this will be, you will have reviews like this, and the average person can just go there and can actually read the reviews themselves. Now, another thing is you could be offering multiple location, or, I know most of you are small practices, but let's say if you have a larger group, so a patient might be going in and searching for your group. So let's say Baker Health, and they can search. So they will see the organization if you have a larger group. So this practice has 11 providers, and this is all the availability within the practice. And if the provider is in more than one location, when they click on that provider, they will be able to see the availability within each location. So this is the Clifton location, or this is the Monarchy location. Now, this can be also integrated with your website. So when a patient goes to your website, they can click on it and it gets into your MEDISOFT, and the whole thing goes into MEDISOFT. So this can save you on the workflow. It makes it easier and makes you look more sophisticated to the patient. And it's a great service for the patient, so they don't have to wait for the practice to open to be able to schedule an appointment. And now this is offered fully free. So you will get it for free for 3 months, and there's no obligation. There's always going to be a free account, but the account that integrates with MediSoft, there's a small fee. I think it's $49 a month, but you get in 3 months for free and no obligation. We don't take your credit card or anything. So if you're not happy with it, you don't have to renew. But if you use it, you're gonna love it. It's a great convenient for your patient, and it helps you also with your SEO and ends, because when you search your name or your practice name, you will show up on Visita and you will show up on Google, and it's a great way to increase your web traffic and your patient flow. Okay, if you just joined us, we're about to finish the seminar, and unfortunately, good time flies fast. We recorded this seminar. We're going to share it. You're going to get it through the same email that you got your invitation. We will share the recording. But if you rather speak to one of us in person, this is my contact information. And this is, again, Robert Gabriel, President and CEO of Microwize. And so before I end this meeting, I want to thank you so much for taking the time out of your busy schedule to join us. I want to thank you for your business. And this is my email. This is my direct phone number. I want to thank you so much for your time, for your business. Have a wonderful day. And I wish to see all of you on Visita and in future meetings. Thank you and have a wonderful day.